Hello, my name is Miranda Brown, and I am a licensed professional counselor at the Student Mental Health Center at the LSU Student Health Center.
Hi, my name is Nathalie Cahill, and I'm one of the pre-doctoral interns at the Student Health Center's Mental Health Service.
And we would like to welcome you to the Emotional Wisdom webinar series. Within this series, we discuss practical skills for handling stress, anxiety, and depressed moods in everyday life. Rather than dismiss emotions as unhelpful or messy, we encourage you to view them as an internal compass, leading you towards something or away from something. When faced with vulnerability, we tend to feel anxious and scared. When we experience loss, we grieve and we feel sad. When we are faced with injustice, we often feel angry and unheard. All emotions have purpose, and we can choose how to respond to those emotions. If you learn to pay attention to what emotions are telling you and practice helpful ways to respond to them, those intense and uncomfortable emotions, you will be better prepared to navigate the ups and downs of life. This is what we mean when we call it emotional wisdom. We encourage you also to actively seek out additional support as you need it, whether it's accessing our mental health services and counseling and the additional services that we offer, or if it's through our LSU Wellness and Health Promotions. And also, if you are looking to receive some medical services, we also have those services as well. Today, we will learn and practice active in the moment coping skills to use when you feel stuck in depressive moods, when getting out of bed even feels tough. This coping toolkit for low moods aims to help motivate you to face the day and begin to feel better. Nathalie?
So let's talk about some ways we can recognize distress. While everyone experiences ups and downs, it's important to learn skills for how handling low moods, those kinds of moods that persist or could disrupt your ability to engage in daily life. So, how do we recognize them and how can we choose to respond? First, some emotions like sadness or anger or even fear can be difficult to sit with. You may desire to push these feelings away or find things to distract yourself with. But what helps most to acknowledge is what you're feeling and learning how to calm or soothe yourself. Second, low moods can involve negative mindsets about yourself, others, and the world around you. You can learn to challenge these thoughts and embrace healthier mindsets with practice. For instance, it helps to cultivate patience and kindness towards yourself and others when you may feel pretty inclined to be rather judgy or super critical. Third, low motivation may seem to keep you from doing the things you know might be helpful. It could feel like you're moving slowly or that you're completely stuck and everything's getting in your way, you included. What helps is to get moving even in small ways and build momentum by setting reasonable goals. This helps to feel like you are and able to create change. Finally, social connection is a vital strategy for combating low moods. You may need to reconnect to those close to you in your life or explore new ways to access the support. We will now discuss key coping skills you can learn and practice, or what we like to call the how-to guide on how to respond.
Okay, we're going to talk about soothing with the senses. And this is a skill that is helpful when you're feeling intense and perhaps uncomfortable emotions. You can evoke your physical senses to help soothe yourself. Consider what you see, feel, hear, or taste that feels comforting to you. And this chart gives us some examples. When you see something, you can think about watching the sunset or the sunrise, dimming lights, visualizing, puzzle, or coloring. When you think of what you can hear, we like to listen to music, sounds in the nature, guided meditations. It was raining this morning, and for some people that is extremely comforting and relaxing, and it makes you just kind of want to lay down and take a nap and just be relaxed, be kind of at peace. When we think about things we can feel, I've seen a lot of people talk about these weighted blankets and how it has
Mhm.
helped actually with anxiety. I've really seen some people talk a lot about that lately. So that's something that people are feeling and it is helping with them relax. A lot of people love their pets and snuggling with pets helps. And people getting massages or warm showers may be helpful. Smells, lighting a candle, scented lotion, aromatherapy, and fresh air. Tasting tea or coffee, favorite foods, cooking with herbs or spices, your favorite meals, and then thinking about our body and moving, stretching, rhythmic movement or dance, or walking or running. Just thinking about exercise and getting active. Even getting active outside may enhance that even a little bit more. Some things that I like to do to self soothe are definitely sitting down, relaxing, and enjoying mindless TV. So watching something mindless that I don't have to think about. Some other things I do enjoy, the hot showers, and I enjoy aromatherapy especially, and I tend to lean towards scents that are lavender, chamomile, things like that that are suggestive to relaxation and calming. So those are some things, personal things that I enjoy doing. Natalie, what are some things that you enjoy when you like to self-soothe?
Well, I'm definitely going to add the whole watching the mindless shows you can find on Netflix or Hulu. I am
Yeah.
definitely with you on those. Anything that doesn't require too much brain power for sure.
Yeah,
And I like to cook my favorite meals, especially pasta. Like I'm craving some pasta thinking about it right now.
I love pasta too, Natalie. That's a great comfort food, absolutely.
Hmm.
And we live in the South, so we have lots of great comfort foods. That's a plus of living here. And then the last one that I didn't mention was maybe thinking about deep breathing. That's a skill that we talk about a little bit more in detail in our first emotional toolkit when coping with anxiety. So feel free to
Mhm.
access that. And we talk about some deep breathing, and there are apps out there that can help you
Oh
with
yeah.
that. And also, you can incorporate those essential oils and aromatherapy in that practice as well. And then hopefully, it'll have you feeling a little better. All right, we're going to move on to loving kindness.
So negative mindsets can be tough to shake, as we all know, but practice takes, of course, helps with that. But also we can practice new ways of thinking. So trying a loving kindness meditation, such as the following. So closing your eyes, taking a deep breath, and telling yourself, may I be filled with loving kindness. May I be well. May I be peaceful and at ease. May I be happy. Practice offering yourself loving kindness every day. You can also use this meditation to extend compassion to others. May you be filled with loving kindness. This mindset of compassion can positively impact your mood. And now let's talk about some things related to some behaviors we can do.
All right. In response to feeling stuck, you can also practice a behavioral activation skill called 3 and 3. Think about all the times you may have tried to motivate yourself by creating a to do list only to end up feeling so overwhelmed because your list was so big and it was never ending, right? This alternative strategy actually helps you find a starting point, build a momentum, and balance needs for productivity and pleasure. So, thinking about doing something that you enjoy doing and that you want to do, and adding something that you possibly need to do. Keep tasks simple and small so that they're achievable with a little modest effort. Here's some examples in this chart here. You can wash a load of laundry and then you can make tea. You can read a chapter of an assigned reading and you can listen to a podcast. You can email a professor about a missed assignment and then you can take the dog for a walk. You can reset your 3 and 3 list whenever you wish. And tasks can be super simple. If you particularly stuck, think, get out of bed and brush my teeth. Those are simple things that I need to do. Experts in behavioral change recommend starting with very small habits. So everyday things that we need to do, and then adding something nice for yourself that you actually want to do. And that hopefully will help balance that. Okay. Next, we're going to talk about increasing connection.
So today we're going to round out our webinar with talking about how we can connect. If you were to map your social connections as concentric circles with you at the very center, the closest circle would include intimate relationships, people in your life that you can trust, those you interact with frequently, those you feel safe enough to reveal your more private self with. These are the people you go to most often for support and could not imagine your life without. Often we only have a few intimate relationships, so people like our partner, a friend, or maybe our parents or a sibling, or maybe even a mentor in your life. Beyond that inner circle, you have friendship. These are the people you feel close to, but are not necessarily that intimate. You share events from your life and enjoy the company of friends. These relationships help you find a sense of belonging and know that others care. The next circle represents participation. These are people or groups with whom you share common interests and activities. So people like your classmates or people you go to church with, or people you see often maybe in your fitness class. You may consider them friendly acquaintances and appreciate feeling a part of something. Lastly, the outer circle includes interactions with others where there is some form of exchange or transaction that happens. These may be a bus driver, your professor, maybe the person that does your hair. You may interact from time to time in friendly ways, but they may know little about you. Still, these interactions help you feel seen. If your intimate or friendship circles are sparse, perhaps maybe due to losses or any transitions in your life, it becomes important to rebuild connections or invest in new ones. Those in our outer circles can be brought closer. So for example, maybe you can invite a classmate out to lunch, or maybe join a student organization to meet some new people, or maybe reach out to someone you haven't talked to in a while. Finding connection can have significant and long-lasting benefits on your mental health. So let's talk about some other resources they might find helpful.
Okay, to learn more about coping with low moods, you can visit tarabrock.com to learn more about radical compassion and meditation, resources that reinforce love and kindness. Tiny Habits, The Small Changes That Change Every Day by BJ Fogg. And you can also, as I mentioned a little bit earlier, check out the additional emotional wisdom webinars that are available through our mental health service. And these are some levels of care that we have. Nathalie's going to talk about that.
So for your information, in case you weren't aware, so the way we work is we work by levels. So there's different offerings of different services that are available all the way from the bottom, meaning talking about maybe some coaching things through wellness, or talking about maybe some kits we have that are available in office, all the way through receiving services through us, through mental health service, if you feel like that's something necessary to you. This kind of serves as a guide tool to kind of tell you, depending on where you are and what you're experiencing right now, what might be really helpful.
Yeah, and I'm thinking of that number one, that level of care. When we're in person, we've offered something called Let's Talk, an outreach where we go out and we're just there for people that just want to come in and learn about a situation or a service that we may be offering. And it kind of maybe gives them insight on what may be beneficial to them, even if it's not counseling, maybe it's a group or a seminar that we offer. But that just kind of gives people the ability to anonymously come to us and just kind of get a little understanding or a little plug about counseling and other services that are out there and that are available. So that's another plug for a service that we do offer when we're in person. All right. And the Student Health Center is comprised of a couple of different departments. We have medical, that they offer primary care and specialty care, and diagnostic imaging. They even do some physical rehabilitation. So if you feel like you're in need of any of these services, please access the medical clinic for help. And then you have us, the mental health services, and we offer individual and group counseling sessions. We also offer webinars right now. We offer some other seminars and groups when we're in person. And we have a psychiatrist on staff who prescribes medication. And we also have a very neat eating disorders treatment team that is available. Again, just because you're a student at LSU, you have access to these services. And then we have wellness and health promotion services. They do some wellness coaching and nutrition counseling. There's a dietitian on staff. There are some group programming, some classes that are offered. I know that they offer some self-defense classes, which are amazing to have. Those are great tools. And also, I do believe that staff members can access these as well. They do a lot of outreach events. And then there's the Lighthouse program, and volunteer opportunities are also available in wellness and health promotion. So these services that we have to offer are available to you guys to access at any time. And if you need any more information about any of them, please do not hesitate to contact us. And Natalie's going to give you that information.
Well, we have many ways you can find us. We have our website. You can also follow us on all the different social media platforms, Instagram, Twitter. And of course, like I said, the website allows you to access your patient portal, which allows you to book appointments and those kinds of things, which is really, really helpful.
Absolutely. And you can also find additional information like our telephone numbers and how to access each clinic separately, maybe online for some services, and just different things are available for you to find out on our website. So please visit us if you would like any additional information. And we would like to thank you for tuning in with us today.
Yes, thank you guys.
Okay, bye-bye.